Most women who develop breast cancer, in fact, don't have a family history. So what are some of the other risk factors? Increasing age. The older we get, the higher the risk of breast cancer. So we see that the peak incidence in the population of developing breast cancer is somewhere in the late 50s and early 60s. So it's important to remember as you get older, your risk isn't necessarily decreasing. Other risk factors for breast cancer have to do with how much estrogen, the female hormone, estrogen, is in your body. How do we get a handle on that? Well, we ask questions like, how old were you when you had your first menstrual period? The earlier the age is at the onset of puberty, that means that there's a higher level of estrogen that's already starting to go through your body. Then we ask about the age at the first full-term pregnancy, delivering a baby. The younger you are when you have your first baby, the lower the risk is of developing breast cancer. And that's because pregnancy actually interrupts the amount of estrogen that breast tissue is seeing. The hormone levels change during pregnancy and lactation, and that's a healthy thing for breast tissue. The later the age of menopause, the older you are when your periods stop, is also a risk factor because that's telling us that you're having these higher levels of estrogen for a longer period of time in your life. So we look at the course of a woman's lifetime, the age at the onset of her first menstrual period, the age at which she had a first full-term pregnancy, and the age of menopause as a way of getting a handle on the estrogen levels in her body. It's also important to know if you've been exposed to hormones in other settings, such as oral contraceptives, birth control pills, the hormones that are sometimes used to help with fertility, and also hormone replacement therapy after menopause. Right now, the information we have tells us that there does not seem to be an increased risk of breast cancer related to either birth control pills or a short-term use of fertility treatments. There is, however, good data that tells us that for women who are taking hormone replacement therapy after menopause, that there is an increased risk of breast cancer. And we've seen that when the number of prescriptions for hormone replacement therapy decreased after this information became available, that we actually also saw a decrease in the number of breast cancers diagnosed in those women.